I'd like to welcome in Dr. Michael Fine. Thank you for joining us today.
Thank you, Kate.
Former director of the Rhode Island Department of Health, physician, expert on the healthcare industry. Brought him in today with the very big, groundbreaking news that we heard. Amazon, JP Morgan Chase, Berkshire Hathaway, all teaming up to form their own healthcare company. So when you saw this news, or maybe you had some inklings that this could potentially happen, how big is this that has the potential to just disrupt the system?
Kate, I don't think we know. I don't think we know enough about what they intend to do or how they intend to do it. They've done a little talking about making it technology focused, but for me the operative word is nonprofit. If you read what they've put up, they emphasize nonprofit. And that is the critical idea, that there will for once be someone trying to do healthcare who's not trying to make a profit off somebody else's back.
Now, here we're looking at a number of companies that have profit very much at their bottom line. Why do you think they sat around and said we need to come up with a new paradigm shift?
Because the cost of healthcare is a major limiting factor on the ability of companies to profit. When General Motors went bankrupt in 2007, it at that point had expenses of about $4,000 per car that were healthcare expenses. That was a fixed expense, and it limits their ability to profit. So if they're going to profit doing with the businesses that they have, they've got to keep their healthcare costs lower. And that's been a major challenge for them, as it is a major challenge for all Americans, and a really major challenge for Rhode Island.
How nervous do you think the Uniteds and the CVSs and sort of the big legacy healthcare entities feel today?
Oh, I think they're all a little bit nervous, but they're all changing. United is moving out of the insurance industry and into the healthcare delivery industry. CVS is moving into the insurance industry. Everybody's trying to figure out how to do this and do it in a way that delivers better outcomes for lower costs.
And speaking of which, I don't want to jump topics here, but one of the ones we've talked about is the cost of especially the healthcare here, what we see with the hospital system. I don't think I've had you in a while to talk about Care New England and Partners and Brown. I kind of want your sense as to what we heard last week, Partners and Care New England moving forward with the definitive agreement. You've got Christina Paxson up on the Hill, gnashing of the teeth. What's your sense of the situation? What's in the best interest of Rhode Islanders?
Well, I think it's in the best interest of Rhode Islanders to do a couple of things at once. The thing that we want to do most is build a primary care delivery system that takes care of all Rhode Islanders. If we got every Rhode Islander primary care, we would reduce the cost and increase the outcomes, or improve the health outcomes. We also want to keep jobs here, and that's an important thing for us to do. The ability of our healthcare system to be a system and not a market is pretty limited, and that's one of the stressors. How we make all this work, I'm not sure I know. All I know is that when we emphasize the hospital system and de-emphasize the primary care system, we aren't going to get the outcomes we want at the costs we can afford.
That's one of the talking points that people keep bringing up with Partners looking here is Rhode Islanders up 95 to Boston for specialty care, for when it's come to a point that they need these specialty physicians and not the primary care model.
Well, I mean, I think that's always been a tension. There are a number of services that are available only in Boston or in New York. And when you begin to understand what we call the incidence and prevalence of disease, how many people we have with very rare conditions, we begin to understand that there are some things that we just don't have a big enough population to support expertise in. And so there's always something that will need to move elsewhere. But that doesn't mean that we can't do the best job we can providing the most care we can to people who are here. Because when you are sick, when you have cancer or another chronic disease, and you're stuck on 95, that just isn't where you want to be, or isn't doing what you want to do.
And do you think those factors should be in play as the state, from a regulatory standpoint, takes a look at this? We had Commerce Secretary Pryor in here concerned about jobs. We have yet to have President Paxton in, but a concern of Harvard coming in and putting a stake in the ground and overshadowing Brown and its relationships with hospitals. Are those sort of quasi-political concerns valid in this conversation?
Well, I think when I hear hospitals, I think jobs. There's no evidence that the number and location of hospital beds has any impact on population health outcomes. We do know that when you see a hospital, you get jobs. And so if Rhode Island wants to have and hold good jobs and good healthcare jobs, we want to provide as many of the services as we can locally. I was here, I think, in the spring, and I think what I said was at that point that the Care New England Partners deal represented a massive failure of health policy in the state, and I still believe that. Our problem isn't regulatory, it's political. The problem is that we just don't have the resolve we need to focus on what the population as a whole needs, and we don't have the resolve we need to build a healthcare system that's for people, not for profit.
Well, a huge focus right now, obviously, on this deal, and you wear many hats. You oversaw it from that 10,000 foot level. You were boots on the ground from the physician level. And speaking of which, the big story right now is the flu. Talk with us. We've seen the flu shot doesn't address this particular strain. How did it get this bad?
It's this bad. The flu comes and goes. And we get an epidemic every year. It's a much more serious disease than people understand. It kills about 30,000 Americans every year. And not enough people get flu shots even when they don't work well. So in the United States as a whole, and Rhode Island as a whole, we immunize only about 50% of the population. If we could immunize more people, we would prevent the flu much more effectively. But the problem is, as you said, we don't always have a great vaccine. It doesn't mean we should ever give up on getting people vaccinated. And it doesn't mean that people, when they're sick, shouldn't stay home and be careful about hand washing and other sorts of basic infection control processes that limit its spread. Sometimes it's just being careful. What most people don't understand is that only about 10 or 20% of us get the flu every year. So we tend to forget about it. But it's still, having the flu is much like being run over by a truck, where that's the way it feels. It hurts to raise your head, it hurts to comb your hair, it hurts to think. When you have it, you know it. And it's important to, when you have it, drink plenty of fluids, rest in bed, and take your time so you don't get sick from another problem.
And, here we are in the age of social media. We experience the flu every year, but now we see on a real-time basis these cases of the children and the parents, and just came down with the flu in 48 hours, were dead. I think folks might have a lot of concern. Well, when is it so bad that I need to go to an ER? And there are just circumstances where, as we see, that there's just nothing can be done.
Well, obviously it's a real challenge to know what to do most for yourself. There is a medicine that helps reduce the length of the flu, but you have to start it in 36 hours, and it doesn't really change the course of the flu very much.
Okay.
Like I said, the important thing, I think, is to, when you know you're getting sick, drink plenty of fluids, talk to your primary care physician or clinician, make sure you have somebody who knows you and knows how to take care of you, so that if it doesn't feel like it's going in the right direction, you can pick up the phone and get some advice from someone who knows you.
And wearing many hats, one of your announcements this week, your writer hat.
My writer hat.
Talk with us about your writer hat. You sent out an email to a broad group of people, we shall say, that you've been writing, and as you said, instead of looking to go through traditional avenues of getting your works published, want it to be a community of folks who opt in to what you've been putting forth.
So I'm actually doing two things. I have a book coming out in September called Healthcare Revolt. It's about health policy.
Okay, we're taking a little step this way. Okay, so the big book, the print book.
The print book.
Will there be an e-edition?
There will be an e-edition. And I also have been trying, I've been writing short stories for a long time. Many of those short stories are based in Rhode Island, not all.
Is this nonfiction?
No, the short stories are all fiction.
Based
all
in Rhode
fiction.
Island, though, will people recognize themselves?
I don't think so. But, you know, we have lots of political problems, and we have lots of conflict. And somehow we seem to have a hard time seeing our common life. And so these are stories that aim to use the imagination to help people to see that common life.
And you're so busy. How much time do you get to sit down? Are you a computer writer or a pen and the paper writer?
I'm a computer writer, but I now write for 4 to 6 hours every day, and I've been doing that for a couple of years.
And do you have a specific writing area? Do you have a routine?
I have a complete routine. It's a discipline, and it's worth following that discipline.
Well, again, you're everywhere, again, in the healthcare world talking about what's going on. I applaud you for that discipline to sit down, to be able to write things out, and we'll provide that link as well for Dr. Fine's works on the link when we have this up later. Anything else you want to share with folks while we're in here? I mean, wanted to bring you in again because of this news today. You see Amazon, Berkshire Hathaway, and J.P. Morgan Chase in the same sentence and coming together for something. It makes the stock market take a pause.
Well, I think the important thing from my perspective is not to get distracted by the news. To keep a focus on what it would be like to have a healthcare system that's for people, not for profit, and that takes care of everyone. That's what we need to get to, and the only way we can get to that is to get to it together.
And, as you said, keep an eye on that nonprofit model. Would that have, in your opinion, the potential to either grow or be replicated?
I think it does have the potential to grow and be replicated. There's some legislation being introduced in Vermont. I think it's going to be introduced in Rhode Island that makes the case about how we might create a healthcare system that creates one neighborhood health station for every 10,000 people. And there's interest in it around the country, and I think our job is to, in Rhode Island, get there first.
Okay, well, keep an eye on all things healthcare. And Dr. Fine, I appreciate your taking the time to go through a myriad of issues, and hopefully we'll have you back here soon.
Thanks again.
Okay, Dr. Fine,
Great
I'll
to
let
see
you
you
go
again.
around the corner.
Thank you.
Okay, it was a busy day here in the Navigant Credit Union Broadcast Center. Eva Gaudet up at 3 with entertainment. Kicked off the 4 o'clock show, as we usually do, with Jennifer Lawless down at American. State of the Union tonight, but lots going on in D.C. otherwise. Dave Kane here as we approach the 15th anniversary of the station fire. His son Nicky, the youngest victim, talking about remembering the lessons learned, not just on the anniversaries, but every day moving forward. Joe Trillo, the former honorary Trump campaign chair, again looking at State of the Union, how he views Trump, his run as an independent for governor here, and he's got some campaign events coming up as well. And Dr. Michael Fine, the former director of the Department of Health, again, urging people to keep an eye on the non-profit news of Amazon, J.P. Morgan Chase, and Berkshire Hathaway announcing that they're forming their own healthcare company for employees. Tomorrow we'll be back at 3 o'clock with The Taste. I think it's a little bit Super Bowl and a little bit Valentine's Day. Rick Simone always brings the best here in studio. I'll be back at 4 o'clock with news and politics. Have a great lineup for you there as well, so look forward to seeing you. Of course, stay tuned to golocalprov.com for more news, lifestyle, sports, and of course, follow us on Facebook as well. So thanks for watching. We appreciate your feedback. We'll see you here tomorrow. I'm Go Local News Editor Kate Nagel. Editor Kate Nagel. Editor Kate Nagel. Editor Kate Nagel.